Well, welcome everyone. My name is Dr. Gentry. I'm the Program Administrator at Middle Tennessee School of Anesthesia. Thank you for joining us tonight. I hope I can provide you some information about our program and maybe answer some questions. And so I would like to go ahead and I'm joined by a couple of people. Aaron Hastings is the director of our IT department, so he's assisting us tonight. And I know many of you maybe have talked to Lindsay, and Lindsay's a little under the weather, but she is with us as well, but won't be on screen or answering any questions. So I will get to the questions in the chat section after we finish a little short PowerPoint, and then open to answer questions as long as you have questions. So I'm going to share my screen at this time, and we will get underway. You see the PowerPoint there, Aaron, just to confirm?
Yeah, and it's presenting right now.
Okay, excellent. Well, this is my contact information, my email address, as well as my office phone number, Lindsay Stein's email and phone number as well. She is the admissions coordinator, if you do not know who that is. Let's start at the beginning, it would be helpful. So this is our campus. We are located in Madison, Tennessee, just a couple of miles north of Nashville. This school has been in existence since 1950. We are one of the oldest anesthesia schools in the country, and one of the few remaining independent schools, if not the independent school left in the country. We do one thing and one thing only here, and that is nurse anesthesia. Currently, we are a doctoral of nurse anesthesia practice degree. We just graduated our first doctoral cohort in 2020, despite the many obstacles that I know you were also facing in the ICU with COVID and a brief shutdown of our clinical sites. But we are a small campus. We have 3 buildings, 2 on one side of the road and 1 on the other. And so the only thing we do here is nurse anesthesia. We do have an acute surgical pain fellowship on site as well for practicing CRNAs that are interested in acute surgical pain, ran by Dr. Bill Johnson. And we also have a completion program for those CRNAs who want to go back and get their doctorate. But that's really the 3 things that we do. So what is nurse anesthesia at Middle Tennessee School of Anesthesia? We have a tagline here, reflecting Christ in anesthesia education. And so I want to expound upon that just to start with. And so this is a unique school. It was founded by the Seventh-day Adventist Church, and we maintain a lot of those same principles of the Seventh-day Adventist faith here at Middle Tennessee School of Anesthesia. We expect our students as well as our faculty and staff to conduct themselves in a Christian manner. This is a place where we do pray before we have events. We do pray potentially before a class. So if an instructor feels strong enough to lead that, certainly we do in big events that we have. And anytime a student comes into my office for whatever reason, we will open that discussion session with a word of prayer. So kind of unique as far as an anesthesia school. We base everything off of that, and from that is one of the reasons we believe we are different than most anesthesia schools in the country. So what about our nurse anesthesia program basics? And just a few questions here to start. And so how many years of experience are required to apply to our program? A minimum of 1.5 years of experience, and that needs to be beyond your orientation and before the application deadline of May 31 of each year. You must be a registered nurse in a critical care area. I'm sure you are aware of that. If you're here to get a little bit more information, you already know that that's a requirement, but we do list out the intensive care units as well. This years of experience has increased for us. We did have it at 1 year of experience, and that was a faculty decision that we moved it to 1.5 years of experience. CCRN is required for every applicant, and that was a little bit of a difficult situation for those who had 1 year of experience. to have taken that CCRN. So the 1.5 years also kind of gives you enough time to obtain that certification. Length of the program is 36 months. We start in January of each year, and then we graduate each year in December. That is a little different for us. We normally have graduated in November with a master's program with a July start date. So this is very different with the doctoral program. The application cycle is open. It started opening January 1 and will remain open through May 31st. And so I will show you a couple of slides related to this, but what is the average GPA of applicants that are accepted to the program? And both from a cumulative perspective as well as a science perspective, the GPA is around 3.4. How much is tuition? Currently, the tuition and fees is right at $95,000 for the entire program, obviously paid on a semester basis. And because MTSA is a private institution, there is no in-state versus out-of-state type tuition. Every tuition dollar is spent by each student in the same manner. And so it doesn't matter if you are within the state of Tennessee as a resident or from any other state in the country. Is a BSN required? A minimum of a baccalaureate degree in nursing or a licensed registered nurse with a baccalaureate degree in a related field of science is required to apply. Most people that come to this program are baccalaureate prepared nurses. If your baccalaureate degree is not in nursing, you must have at least 15 semester hours of biophysical sciences beyond the basic nursing degree. And that kind of equates to that level of the BSN. Chemistry course, most nursing programs have a chemistry course, and so if your program did not, then we certainly would like to have a conversation with you, but we do require a basic chemistry, biochemistry, or organic chemistry course, then that is a requirement. Do you require the GRE? And yes, we do. We look at a minimum score of about 150 verbal and quantitative is recommended, and knowing what the classes over the last couple of years have had, that's really where the cutoff has been, is about 150. The GRE is waived for those applicants who have a master's or a doctoral degree from a regionally accredited college or university within the United States. Will any class credits from other institutions transfer or be accepted by MTSA? And the answer to that is no, because we are a single purpose lockstep program with an anesthesia focused curriculum, and so we don't take outside credit. I actually did review this for a student who just started in the program in January, who took a course in pharmacology very similar to their first pharmacology course, but it was going to have to be a major change with our handbook and policies and that kind of thing. So we had a good open discussion with the student, and she understood. So our class size, we can take up to 72 students per cohort. That varies year to year. Sometimes we end up with 71. You know, people get in other programs, decide this is not the right time for them to go to school and those kind of things. And this year has been unusually problematic in a full cohort, just from the sense of COVID and all the issues related to COVID in your home state or hometown and those kind of things, and it's put a lot of stress and strain on people this year. So we had more people drop out of the program that had accepted, but we did fill the majority of those slots. I think we had 71 in the cohort that just started a couple of weeks ago. So what does our academics look like? I will start this conversation by saying we're always looking at our curriculum and trying to see what can we do better, and what do our students and their evaluation state about our curriculum, and what recommendations do they have. And so we started this doctoral program with an online first semester. It's only 9 credit hours. We've moved a couple of classes around because of instructors and different content that may be a little bit easier to deliver online. But currently you take a pharmacology for advanced practice nurse. This is taught by a nurse practitioner, Dr. Gooch from Vanderbilt University, and it's really about those general types of medications that any advanced practice nurse, whether you're a nurse practitioner or a CRNA would be using. And introduction to nurse anesthesia profession. What is this profession about? It is our responsibility to educate you on that. Anatomy and physiology is just kind of a general, let's get everybody on the same page in that regard. Advanced health assessment is a course that we feel like is delivered very well online. And so that's one of those courses we moved into the first semester. And then math for the nurse anesthetist. We kind of want to get everybody on the same page. And this course has kind of grown over the years. And this year also has some statistics in that course as well. So second semester, you would be on campus full-time, 13 credit hours. You would then start doing basic principles of anesthesia, where you learn about the actual anesthesia machine. You would spend time in the simulation lab learning about that, putting your hands on it, taking it apart, knowing how it works, as well as being able to do a machine check, which is a kind of day one requirement in the clinical setting. Advanced Pharmacology 1, more towards anesthesia related pharmacology there, and that course will continue in a 3 series for the next 3 semesters, starting semester 2. Advanced Anatomy and Physiology 1, and that is also a series of courses spread out over 3 semesters as well. Physics, chemistry, and biochemistry, we'll go ahead and get that in semester 2, understand a lot of principles of physics and chemistry related to anesthesia, and there are content within your board exam on all of this material, certainly. And again, a unique class for us is Religion in a Christian Worldview. That is a 2-course series, semesters 2 and 3. And that course is very unique. Pastor Ken Wetmore teaches this course for us. He is our chaplain of the school, and he presents this course in just opening your eyes. You do not have to be a Seventh-day Adventist to come to this program. You can be of any religion or no religion. We do not discriminate in that regard at all. And so, but he wants you to think about your life and how it applies and how you take care of your patients related to that Christian view, as well as what are the implications of anesthesia to people of other religions. And he does a great job of bringing in guest speakers from other religions, and they can give you their firsthand account of what their perceptions of anesthesia are, and some of which, as we all know, some people don't accept blood products and those kind of things, and so they get to explain to you what that means to them in a firsthand personal view. Simulation does begin in semester 2 and continues for several semesters, and so you're actually getting into the simulation lab where you're putting your hands on the machine, as well as masking and intubation and all of these things in the second semester. Now, we may change some more things. You know, we are looking at the first semester maybe not being online, and certainly we would let all our constituents know that via our website, as well as any blasts that we can send out so everybody would know, as well as at interviews specifically, and we will probably have that answer by the time interviews are over. Third semester is a significant number of hours there. You can see the credit hours do go up. And so advanced principles in nurse anesthesia here, what are the surgical populations that you're going to be taking care of in the OR, and that's kind of where we start talking about that. Advanced Pharmacology 2, again, Advanced Anatomy and Physiology 2, Religion and Christian Worldview 2, and we do start clinical in semester 3. Now, COVID threw us a curveball this past year, and it did delay our start in clinical. All of our clinical sites did shut down, and they have resumed, and nothing has been, we've not reverted back to being shut down in any of our clinical sites, which is a good thing. And so that starts beginning of September, semester 3. Evidence-based practice 1, and that's one of the main heavy doctoral courses that spans 3 semesters as well. And so Dr. Lee Taylor is currently teaching that course, as well as continuing in simulation, and then having an advanced physiology and pathophysiology of pediatrics that does include the neonate and gets you oriented to anesthesia related to that population. Semester 4, still about the same number of credit hours. This is where we are currently. This starts in January. Regional anesthesia taught by Dr. Bill Johnson, who is the head of the completion program, as well as the acute surgical pain management fellowship. We have a quality improvement for safety and wellness. Why do we do the things we do? How do we take care of our patients? And what do we do if something does go wrong? And how do we troubleshoot that? Advanced Pharmacology 3, evidence-based practice again continues. And then we get into some of the advanced physiology and pathophysiology of cardiac and respiratory, kind of the major part of that. And, you know, we have to know and be experts in all of the cardiac and respiratory patho and physiology, as well as those surgical related procedures. Clinical practicum continues, as well as simulation. Semester 5, we get into OB and obstetrics. This course we do plan on changing a little bit and adding in some other populations, adult populations specifically, into that course. Simulation does continue, advanced topics in patho, healthcare policy, economics, and legal. That's a mouthful for a course, but I tell you, you learn a lot in that course about the business of anesthesia. What does it mean? How much money does each CRNA potentially can produce? But also, how do you bid a contract? How do you take care of competing in that realm? And then you learn that in that course. Clinical practicum 3. Again, clinical does not stop for the remainder of the program, but it's not full time. Still, that does not begin until we get into semester 6. And then we have ethics and multicultural healthcare. And so we look at, well, what do other people think about pain and anesthesia? And do we interpret and treat each person according to their culture appropriately? 6th semester concepts in clinical. Here's where we start doing a lot of heavy clinical every day, weekends, call, that kind of thing, as well as getting ready for senior board review and taking that big board exam at the end of the program. And so that course runs, as well as the clinical runs the remainder of the program, semester 6, 7, and 8, as well as 9. 9 is a little bit different from the standpoint of a senior elective. This is something unique to Middle Tennessee School of Anesthesia. So the 9th semester, your final semester, about to graduate, you can find your 9th semester in an operating room to do clinical that you may want to go working in your hometown or home state. And so we will get the contracts and paperwork necessary, as long as everything works out with the contract, to allow you to go back there and do your senior elective clinical and then finish up the program there at that site. This is just a slide to kind of show you, we do have clinical sites kind of all over the country. Some of those are, again, senior elective sites, but the majority of our clinical sites that we use on a daily basis are more locally here within Nashville, or about an hour away from the campus here in Madison. It's kind of our rule of thumb for a clinical site that doesn't require housing, kind of thing. Clinical rotations and expectations, certainly couple of our big clinical partners are Vanderbilt Medical Center, VUMC for short, the Monroe Carroll Children's Hospital there at Vanderbilt, where a lot of our pediatric clinical is done. We also partner with AMG, which is a part of PhyMed Group. They have the anesthesia contracts at many of the other hospitals within our town: Centennial, St. Thomas, St. Thomas Rutherford, Hendersonville, Williamson, St. Thomas West, Skyline, Sumner, Summit. All of these sites are AMG sites where we have students, and again, one of our major clinical partners for success. Some of the more recent additions of clinical sites is Stonecrest Medical Center and Southern Hills Medical Center. Those we've had for less than a year, but they're going very well, with students loving those rotations. We do go to General Hospital here in Nashville, as well as Northcrest Medical Center in Springfield, Tennessee, Bowling Green Medical Center in Bowling Green, a wonderful rotation up there in a very different type of practice, And we are going to do a site visit tomorrow in Bowling Green at another AMG site up there. So we are always looking and moving students around to get them the best clinical rotation possible. Give you an idea of our cases, we do pride ourselves here at Middle Tennessee School of Anesthesia about the type of clinician that we produce. And so these are the average and high case numbers for the class of 2020 that just graduated. This was at the time I gave this presentation last, but we had someone who almost had 950 cases with a case average of 762. You need 600 cases to graduate, and so those additional cases above the minimum number by the Council on Accreditation significantly adds to your clinical ability and confidence in the operating room upon graduation. You can see their general anesthetics. They average 446, high of 807. Open heart cases, some people do get 2 rotations to do open heart, and that is something unique for our program, as we have certain rotations where you do OB, you do PEDS, you do open heart, and those kinds of rotations. So PEDS there again does vary. 179 is a high average for the cohort, 88. Epidurals, spinals there you can see significant differences, but again, some people may have a secondary rotation. Peripheral nerve blocks, you are required to have 1. The rest can be simulated in our simulation lab, and you can see those numbers significantly more than 1. A little bit more about the peripheral nerve blocks. We do have something unique, again, cadaver labs several times a year. The students get to participate in those cadaver labs, and we have anatomists come over and actually take out the nerves so you could see the nerves. And then you can ultrasound the other side of the body and know exactly kind of what you're looking at from one side of the body to the other and make that connection. Total clinical hours, again, way more than the Council on Accreditation minimum. And so that doesn't come with without a lot of hard work and long hours. And so, but your benefit again is going to be that confidence when you leave the program and start your first job. Institutional statistics, we do put these on our website, so we have to follow. Currently, the 2020 class is still in process of taking their boards. We're running right around 80% on the first time pass rate, and the second time pass rate at roughly 90%. So we will get those statistics updated on our website, which very soon, which is a requirement by the Council on Accreditation as well. Here you can kind of see the GRE verbal and quantitative scores, kind of average there of what our candidates had for the last admission cycle, as well as those GPAs roughly around 3.4 for both years of experience as well as science and cumulative GPA. And again, here's my contact information, and I'm going to exit out of this to see if there's any questions within the chat box. So that is an overall GPA, and so that's not just your nursing GPA. We do take into account, sometimes people don't do very well when they first get into college, and so that is again the average. We do interview people with less than a 3.4 GPA cumulative. I'm going to keep scrolling here. Would the Advanced Pathophysiologic Foundations course offered by MTSA be beneficial to take before applying to the CRNA program? It is not a requirement, but it is beneficial because it kind of starts you in that process of that anatomy and physiology that makes sense to what you're doing in the ICU, which is a little bit higher, deeper understanding than maybe what you got in nursing school. And then when you get to anesthesia school, we take it to another level, and we apply other more complex principles along with that to help you understand the physiologic processes of a patient undergoing anesthesia. So certainly it is a good course, but it is not a requirement for admission to the program. Well, I hate you have to leave early, but I appreciate you joining us tonight. Casey? The chemistry prerequisite, these are things, again, a basic chemistry course is definitely okay. We do have some people sometimes that send us exactly the course that they're going to be taking, and Lindsay and I communicate, and we'll clarify that if there's any question. But a basic chemistry course, it is not a series, it is not specifically an organic or inorganic type course, but a basic chemistry course that most nursing programs usually have. And so but we certainly can verify whatever you're looking at from a chemistry course standpoint. Someone asked about making a C in general chemistry and did poorly the next semester retaking it with a B. I was taking it seriously. Well, I will tell you that, you know, if you retook the course and you made a B, I don't think you would need to retake that course. It's sometimes a situation where if you have a C in a course, specifically your science GPA, that sometimes retaking it does help, but also taking an advanced graduate level course would also look very good, and we look at that as well. So there are many of them, but certainly the one that I was just talking about, Dr. Brett Clay's course, the foundations course, community course, would be a course that we would also look at. But again, sometimes replacing a C with an A certainly would help your GPA more than taking the advanced level physiology course.
Hey, Dr. Gentry, if you want, I can publish these. So if you click on publish, you can just answer those one by one, and I can, as you answer them, I can throw them in there.
Verbally or by typing?
Yeah, verbally.
Okay.
That way you don't have to keep scrolling. I can help you out a little bit.
All right. How holistic of an approach do you consider? Oops, sorry. Great question. What changes have we made? We have instituted a senior board review day. So every student gets one day on campus to dedicate to senior board review, and I lead that class. We do use APEX as our main board preparation material. That is a very structured course. Sorry, battery's about to die, so let me plug it back in. Are we still good, Aaron?
Yeah, we're still good.
Good. I was hoping I didn't lose the whole thing. So we structured that course. It starts out a little bit on the slow side because that is that first semester of full-time clinical, and then we start ramping it up in January because 1 year later you'll be ready to graduate and most likely want to take your boards as quickly as possible. And so it does ramp up from January on. And so we start the on-campus senior board review day 1 day a week in January, and we continue that all the way through spring and summer. And so that provides 1 day out of clinical for you to have some instruction in the classroom that I use APEX to answer those questions. Major things, I think, just having some really good structure, and that's made significant improvement in our board scores. I'm moving to Tennessee soon. Is there any unit in the area that we take students from all types of units. So and it's kind of one of those things when we're talking about the interview process, you know, you want to know more than just what's required of you. And so that can happen in any type of unit. It doesn't have to be an open heart unit. We do tend to see more people come, not just from the Nashville area, but from other places as well. Cardiac ICU trained people get in anesthesia school, but it's not a requirement. Certainly, we take a few students from a neonatal intensive care unit. Not as often, but certainly the population that we care for is mainly adult, but that doesn't say that it doesn't happen. Flight nursing is the one thing we do not accept as ICU experience. because those patient populations obviously vary, but that is one thing the Council on Accreditation is not allowed specifically as an ICU experience. Currently working in the ICU, I would say it's better to be currently working in the ICU, but it does have to be of recent nature. And so it can't be a long removal of time from when you were in the ICU. Great question. Do you have to compete with anesthesia residents? We do have residents at Vanderbilt University. However, you do not compete with them for cases. We, as a senior, you will not be paired with a nurse anesthetist. You will be paired with an anesthesiologist, and you are treated and assigned cases just like the residents. And so we do not compete with the residents. The students literally function as a resident does in assignments and requirements to be ready for your cases, to communicate with your anesthesiologist the night before. Now, as a junior during that rotation at Vanderbilt, you are paired with a CRNA, but you do not have to compete with a resident. And that is the only facility that we are currently in that has residents, anesthesia-specific residents. No, we don't. It is not a requirement, nor would I say that the majority have charge nurse experience. So that is, we do not require that. That is not something that we necessarily weight heavier, certainly. So it is not something that you have to do. If you've done it, great, but certainly it just shows a level of responsibility from where you're working, but you do not have to be a charge nurse. We do not set the actual GRE at no, if you're less than 150, we do not consider that. We look at your GPAs and other things to make that final decision. We do an early interview process that we started last year, and that information is published on our website, what that criteria is. And for the early interview, certainly it is above 150. So when averaging the science GPA, do you cancel out all grades and then do the GPA calculation, or do you combine both of you? We do cancel them out if you've retaken them. We do for your science GPA. So we would remove that grade and replace it and then make that calculation. The early interview process, we will start looking at applications beginning of next month. And then we do plan to start doing early interviews probably by the end of February and start that process. Now, COVID certainly kind of thrust us into doing the online interviews, which we've really never done before. And so when we started looking at that process, we went ahead and started doing some criteria for the early interview, and that's where that kind of formulated from. So clinicals, right now, we do not have any clinical sites that necessarily require housing. I know of a couple of students that have gotten some bed and breakfast type places in certain clinical sites because they may live 45 minutes south of Nashville and the clinical site is an hour north of Nashville. But that is, again, we measure from the school. And so housing at one Bowling Green site, depending on what shift you're working, they may provide you housing. But for the most part, we do not have to get into housing because of the distance from the clinical sites to the school. And if there was, let's say we gained a clinical site that did not have housing, that would certainly be on the student, but calculated into your student loans as well. And the majority of other schools that have that kind of relationship, the students find their own housing. And the process again for clinicals is we're on the docket for change. Currently, we break the cohort into two groups, Group A and Group B, and they go to clinical Monday, Wednesday, Friday, and then Tuesday, Thursday, and then the next week they swap. So you get one full day of that week if you're on Monday, Wednesday, Friday. What we're looking at is doing all-day clinical in the future. So you will do all-day clinical Thursday and Friday. The next week, the next group would go, and we would be doing simulation here at the school with the other group of students. You will not have to take a chemistry course. We do not have a time limit per se on those chemistry courses. Just obviously you would be expected to do well in the chemistry physics course that we have, certainly. How do you prepare for the interview process? I would say you need to be very knowledgeable about the drugs and the cellular receptors that you use on a daily basis. If you list something in your application that you do, then we're potentially going to ask you about it, whether that's if you understand balloon pumps, or you understand ECMO, or you understand this drug or that drug. We're going to probably ask you about it and see what your level of understanding is. And then we're probably going to ask you some questions to see how you think on your feet related to. Now, you may not know the answer, and that's okay, but we want to see how you think when we ask you questions that you may or may not know. So you just kind of have to be prepared for that. Specifically, a scholarship package for the program through the school, we do not have. Certainly, there are some scholarship opportunities through the AANA. Several of our students have received those scholarships, but we do not have a specific scholarship through our school per se for the entire program. We do have a financial aid department, certainly, that can assist you with financial loans for school, certainly. We would need to probably have a conversation related to that. I got an email about that today, is what if someone's not going to have a 1.5 year experience by the May 31? The goal here, again, so you understand, is that you have 2 years of experience prior to starting the program. So looking at the time frame of applications, May 31, if you had a 1.5 years, you would certainly have 2 years by the start of the program in January. And so that's where we would need to know more specifics than I can answer at this time. So a typical day here is certainly if the semesters, let's say semester 2, because we're not in clinical at that time. So we'll be doing classes and simulation Monday through Thursday. Not everybody will do simulation every day, certainly, but classes are in the afternoon. If we go to all-day clinical, then starting semester 3, some classes would be all day, could be every day. And then simulation would be Wednesday afternoon, Thursday, most likely, if you're not in clinical. And then once you get in to the latter semesters, certainly you're just doing straight clinical as well as doing senior board review on your own, with the exception of that 1 day a week on campus. This semester we have Tuesdays, they don't have class. So Tuesday afternoons, they're in clinical all day because we don't have class on Tuesday afternoon. We fit everything in on Monday, Wednesday, and Thursday. So we don't do anything here on Friday as far as classes. The campus is closed on Friday because of the Seventh-day Adventist. We follow that Seventh-day Adventist biblical principle. So we don't do anything here. Actually, the offices are closed on Friday, but clinical does go on Friday. I will tell you that early on in the program, during the breaks of the semester, you are off. And then once you get into the end of semester 3, you work half of the break in the OR and the other half you're off. And then as we move throughout the program and get into that senior year, you'll have certain weeks that you're off And again, we work nights, holidays, weekends, everything in this program. We actually require the certified copy of your GRE scores so that we would see all your scores anyway. You have a nurse practitioner degree, certainly that. I was a nurse practitioner. I was an acute care nurse practitioner, and so that experience would count for applying to the program, certainly. Well, not knowing what your total GPA is, maybe taking an advanced level pharmacology course, graduate level pharmacology, or a physiology course would kind of replace that. I don't think with having that much chemistry, you would need to retake that course, but having a recent course to show that you can work and do coursework at the same time would be beneficial for you, but I wouldn't think you would need to take organic chemistry over again with that much chemistry. Prerequisite timeline, we really want to see pretty much all coursework prerequisite wise by the time we interview. So certainly by the June deadline, so that would be this semester, those kind of things need to be completed. We occasionally will have someone who is taking a course during the summer when we were doing interviews more in the middle of summer, and then we would, if they got in the program, we would put a stipulation that they had to complete the program and also have a grade of A or B in that course for them to be admitted to the program. So that's something we might consider, but certainly we would like to see everything at the time of the interview, and that, again, deadline, we would do all interviews would be completed by the end of June. Oh, what can I do to prepare to be a CRNA? Well, I would say certainly try to learn as much as you can, specifically what you're doing now. Try to have that great foundation in nursing school. Then when you get out, I would say if you can try to spend some time with a CRNA in the operating room to get a perspective of what they do, and I think that would be beneficial as well. And then, of course, just make sure you keep your great grades. Should I take a chemistry course before nursing school, or I took one before nursing school, should I take it again? Well, it depends on what you made. If you made a good grade in it, there's no reason to retake it. No, there's nothing that complex in the chemistry course that you couldn't pick up on and learn, certainly, but I wouldn't say to retake the course if you made a good grade in that course, no. Again, you don't have to have an immediate ICU experience. You will probably be questioned in the interview of why you're not in the ICU. I'll be honest with you, but it has to be within the last couple of years. You're saying here that it's been recent, so but certainly it needs to be recent, and you'll have to just answer that question of why you transitioned into a place that was not in the ICU. Great question. How many applicants do you get each year? The last year, it's gone up every year. We had over 310 applications, right at 311, I think. 311 applications. Our goal is to try to interview 2 to 1. So for 72 slots, that's 144 students. And so we normally interview somewhere 150, 160 in a normal year. Now, last year online, obviously, we did a lot online. And then we did our normal couple of days of interviews, again online. And so it made it very difficult to get up to a really significant high number. And so certainly the early interview process does facilitate, we do accept people. But again, we had a lot of people from our alternate list get called up because people decided to not come to the school for various reasons, get in other programs, COVID situations, not a perfect time for them. And so we did have a pretty deep alternate list that we exercised. So we have a DNAP, so it's specific to anesthesia. And so certainly you get a couple of those doctoral courses a little bit early on in the program, but we've found that we want to wait till you get into clinical to have an understanding of the anesthesia problems or areas for research. And you really don't have a good concept of that till you get into clinical. So our evidence-based practice courses are those 3 series of courses that start 3, 4, and 5 semesters. And so those are certainly in clinical, and we want to try to get you to see what kind of problems potentially are anesthesia related, and that makes us a little bit different because that's our focus. And then that's the EBP series certainly is the foundation of our doctoral program. Now, those other courses are required certainly in the doctoral learning that we give you throughout the program. So, but the foundation is the evidence-based practice courses. We may end up adding a statistics course because it's something we think we need. We are getting a little bit of that in the evidence-based practice courses as well as in the math course this year, but we may end up adding a separate statistics course. You can send all your scores. We did see people who retook the GRE to improve their score. There are some programs out there that will facilitate or help you to prepare for the GRE, and we did see people had good success with that. And we would like to see improvement in your GRE scores if you retake the GRE. But you certainly can send all your scores. I will say at this point, the interviews are going to be online. The latter interviews in June, I can't answer that yet. We will have to make a decision at a later date depending on how COVID is going. If not much changes because of the COVID situation, then all the interviews will be online. It's not hard to apply as a travel nurse. We have interviewed quite a few travel nurses in the recent years, so that is not a difficult thing, obviously, as long as your experience is in the ICU. That's a great question. Should you consider going back to the ICU if you're in PACU? I would say it's a good idea. Certainly, because we do not consider PACU it's almost like being out of the ICU, even though you're dealing with people coming out of anesthesia. But I guess would be a follow-up question is how long have you been in the PACU and out of the ICU? It's kind of another follow-up question. It's both. We, in fact, as far as the interview process, it is more about wanting to get to know you a little bit. The interview process years past certainly was a very short, intensive clinical interview. And now that we're doing them online, we're actually spending twice as much time with each candidate. So we do want to know more about you as a person and why you want to embark on this journey of anesthesia school, and then we get into some clinical based questions and scenario things that we create kind of on the fly and based on where you're working. Someone says they're applying for a second time. Our handbook in this situation, if you are applying for a second time and do not get in, that is, you cannot reapply at MTSA if you do not get in on the second time. So that's per our handbook. That's a rule within the handbook itself. We would certainly look at your nurse practitioner degree, John, because that's your recent experience. Again, some people may start out in school way back and not do so well. And so we look at that, and we look at more recent coursework, and certainly your nurse practitioner degree would benefit you for anesthesia school. I would say it definitely benefited me when I decided to go back to anesthesia school. So certainly we would look at that. We would take that into consideration, especially because you would already have a master's degree, and that's showing you can handle graduate level education. I guess you're asking about a lower acuity unit, meaning either maybe out in a more rural setting versus a higher acuity unit. The council accreditation doesn't differentiate between acuity of the unit. It doesn't have to be a level 1 trauma center to be considered an ICU, certainly. Level 2 trauma centers, you know, so that's not a requirement. We do ask you specifically about what types of patients you have in your unit, so we get a better understanding of what your experience is. And so if you work in a small rural community hospital that has a general ICU, that's probably, it's still acceptable from the council accreditation standpoint. And then we have to just assess what your knowledge base is during the interview process. I would say it is better to be in a higher acuity ICU, but that may not always be optimal or feasible for you depending on where you live. We do not currently take ER experience as ICU experience. Currently, again, the first semester is online. Next year, that may not be the case. And so certainly if it is not online, you would have to live in Tennessee from the beginning of the program. If that were to remain online, you do not have to move here until May and be ready to be on campus in May. If you have more than 1.5 years of experience, certainly. Now, I will say that if you have 20 years of experience, we kind of wonder why people want to go back to school. And research has proven people that have been out of school for 20 years and come back to anesthesia school don't do as well. They have more trouble passing boards and different things. But we are looking at some of the research from the AANA that says the most qualified anesthesia candidate has about 3 years of experience. And I guess I could refer to that slide where we have about 3.4 years on average of experience. And that does mean some people have less. But we certainly think from 1.5 years on up, you've been in the ICU now a while, you kind of know the ropes, you're not taking maybe the more simple patients, you're getting more complex patients. Maybe you have had the opportunity to maybe get some other certifications and other things, but certainly your thought process is different. Look at it this way. A first-year anesthesia student does not think anywhere near like a second-year anesthesia student. And it's kind of the same process. Decision-making, understanding, knowing treatments and being able to have a gut feeling, anticipate things improves as you're in the ICU. Nurse residency, that would be, if that is after you've graduated, I would have to know more about what that means as far as nurse residency. If it is a nurse residency in ICU prior to you graduating, it would not count. Are clinical sites determined by a lottery system or selected based on the student's desire? We have so many students that we don't take what the desires of the student. We try to spread students around to all of our different clinical sites, and that's a benefit of this program, because you see anesthesia given in every possible way by every single anesthesia machine made by different people, who every facility sometimes can be a little bit different in how they do things. And so we allow our students to go to almost every site while they're in the program. Some students do let us know, and we do look at where people live, certainly, that if they want to have a certain rotation, they live in Bowling Green, then they certainly would probably want to do a rotation in Bowling Green. But that doesn't mean you can, if you live in Bowling Green and want to drive to Nashville every day, that's completely your decision. But you may have to go south of town for 45 minutes. And so we measure that distance from the school. If you meet the early interview criteria, and I would refer you to our website to look at the criteria in our handbook. We specifically put that in there for the 2023 cohort, so you can see that criteria. And if you are offered an early interview, then certainly the earlier you get that in, the earlier you get an interview. Again, for housing, we measure from the school. So if the clinical site is less than 60 miles away, roughly 60 miles, you don't need housing, because if you're a senior, you're going to go there, spend all day, and then you can drive back home. If you're a junior, right now clinical is a half day, but we're looking at doing all day clinical in the future, then you would do the same thing. You would drive to what those sites are. Sites are a little bit different from a junior to a senior year. And so you would just drive to those sites, spend the day in clinical, and drive home, so no housing is required. If you were to live so far away, then that would be up to you to obtain housing. It's interesting, people that come into the program would give their right arm to be in anesthesia school. Obviously, no anesthesia school is perfect. We do require a lot of hours, and we monitor our students' hours on a monthly basis to make sure they're not working over the COA maximum number of hours, and no one is normally, they're not even near the maximum number of hours per the Council on Accreditation. And so as you go through the program, though, you get ready to graduate, you're ready to be done. But we try to treat this more like a family type of school. We care about our students. I had a graduate in here earlier, and he's moving away on Saturday. He's moving to Wyoming to start his life. Relationships. You get closer to certain students because of different aspects of clinical. I work at Vanderbilt. Every CRNA and instructor here, administrator that's a CRNA, still remains active clinically. And so we see you in the clinical site. You come in and give us a break, or we may come in and relieve you. And so we form relationships, as well as, we haven't gone in recent years, but we do some mission work. If we take students with us, we get to know them pretty well while we're on these mission trips. And so I think people do cherish their time here. We're not perfect. We're still looking at how to make things better. And I think some of it is what you make of it. It's also kind of like the hours and cases. The only way to get those 900 and something cases is to work really, really hard, but you'll benefit from it when you graduate. The advanced pathophysiology course is offered twice a year, so it's offered right now. and is offered in the fall. So it is currently going on as we speak, and then it will be offered again in the fall, not during the summer. You will not need to take a chemistry course if it has been longer than 5 years. The only application, certification that we look at is CCRN. Now, we have had people that get a lot of other types of certifications, and that shows that you take that upon yourself. So we don't weight them though, but the CCRN is required. Again, we have about 300 applications. Again, that's gone up over the recent years, but we want to see three times the number of students that we can admit, but we see way more than that. And certainly we were over 4 times that this past year at 310, 311. And then we start narrowing them down, looking at everything from years of experience and science GPA and cumulative GPA and all these things, and we have to figure out how to get that applicant pool down to a acceptable level to interview. And so the competition is different every year based on the applicant pool. If you are a family nurse practitioner in acute pain service, that we would probably have to review, because again, if you were an acute care nurse practitioner working in a unit, but you do have some peds, we would have to probably talk with you and answer that on an individual basis. If it is a ICU at Centennial, considered an ICU, that is, we would consider that, but I don't recall that. I would have to refer to someone, my assistant, who certainly would know that. She works at the AMG Anesthesia Group, which is at Centennial, and I would need to get her expertise on about the bone marrow transplant. I don't know that we've specifically had anybody from there apply, but I didn't know there was a bone marrow transplant ICU at Centennial, to be honest. Not saying no, I'm saying I would need to know more information before I could answer that. No, you can let us know that you're taking that course. That goes back to the same scenario that I was talking about earlier. You can submit your application, state that you're in process in a graduate level course, and then we will look at your application as well as look at what course you're taking. And again, that all of it would go into the fact that you are taking that course and whether you do get an interview. If you got an interview last year, certainly I think you would probably get an interview again this year, but we would then, again, require you to take that course to completion and have a passing grade of A or B. Well, again, we would be doing interviews well before the application deadline. The deadline of May 31, we had done quite a few interviews by then. And so we would do what we call a general interview in June following that application deadline. And so if you meet the criteria for an early interview, certainly you can go ahead and submit that, and you would have an interview well before the deadline of the application. Do you work with people that have families? We kind of treat everybody the same, certainly, so you would not get any difference in your rotations or requirements if you have a family. So that's something to certainly consider. We don't make provisions for people who have families versus people who don't have. When we used to go to Ohio, there were people that got drawn to go to Ohio that had families, and certain people didn't want to do that. They didn't want to be away from their family, and some people had to go, and some people got other people to take their spot. But we don't make any necessary provisions or variances from the standard of which we expect everyone to uphold. We have traveled to Haiti and on multiple occasions over the last several years, but certainly with COVID and now some of the civil unrest in that country, we haven't gone. We also go to Guyana and assist an anesthesia program down there, the only one in the country, and try to help educate their students. We were to go to Guatemala last summer for the first trip to that location. However, that got canceled because of COVID. So certainly we do some international mission trips with our students. We look forward to doing them again. It's just a matter of when. You can come by and visit the schools. Certainly you would have to, have all of the proper temperature check and all of those things for COVID related issues. So that's the only thing at this point that might prevent us. We haven't had a lot of visiting because of COVID, and that would need to be scheduled certainly through Lindsay. Yes, travel ICU experience does count. We've had several people over recent years who have been travel ICU that have applied and have gotten in, and a lot do apply. It is obtainable. It is certainly from being a parent. I went to school many years ago with 2 small kids, and the student I was just mentioning in here, I think he had four kids, and several students in that cohort had multiple children, and it is manageable. It is manageable. We do have Saturday, Sunday clinical rotations. There is a provision in our handbook if you would prefer not to do clinical because of religious reasons on Saturday. What that would mean is you would do more Sunday rotations. We've exercised that a time or two, but for the most part, people just go ahead and do Saturday and Sunday, and that way they don't have to do multiple different weekends. But we do have that provision if it is a religious Sabbath day for you and you would rather not do clinical on Saturday, you would just have to do more Sundays. We do not allow a third-time applicant at MTSA. If you apply twice, it doesn't matter if you take a graduate level course or not. Our handbook does not allow you to apply a third time. How many people generally apply? Last year we had 310, highest number we've ever had. So normally we see somewhere 270, 280 applications, but it's gone up the last 2 years in a row. And because of COVID, we did our interviews all online last year. They were not in person. That's again one of the reasons, as well as to partner with our local community, started doing early interviews. We created some criteria for an early interview process, and then our regular interview process in June occurred online as well. Last year we had, again, 310 applications. We have to narrow that down certainly because we don't interview that many people. We understand under the current COVID situations, a lot of people have not allowed shadowing. So we don't weigh shadowing hours significant. And if you have some, that's great. We will ask you about your experience, but it is not something that is a requirement. You do not have to log how many OR hours you have. You can certainly put that on there, and we will see that on your application. Does it make you a more favorable applicant? I don't think it weighs that significantly when we were considering students. You need to know about the profession you're trying to join and what that means. If you don't necessarily have to shadow somebody to understand that. So doesn't mean that you're a better applicant if you have or haven't. And under the current situations, we're not really considering shadowing at all because many people can't even get into an OR because of COVID. It is possible at the current first semester with it being online, but if that changes and you are on campus, working is going to be very, very difficult and almost impossible as you get further into the program. You have to let me know and have clearance to work as the program administrator, and then if your clinical and or didactics fall behind, then we will ask you to stop working. But most people do not work during the program. Well, if this is your first time to apply and you didn't necessarily need that course, you do not have to wait to apply. So you can go ahead and apply, and then we'll add the grade to your application at a later date. Our reference letters are specific within our handbook, who those have to be from. And so I would just refer you back to the handbook, and that way, I believe it's also in the application on Nursing Cast, who those reference letters are specifically should be from. Do we allow international clinical? The Council on Accreditation will not allow students to count international cases. So cases that are completed outside of the U.S. They do not frown upon us taking students on international mission trips, but you cannot count those cases for your total case count. As in maybe for senior elective, we've had a senior elective student or two go on a mission trip during senior elective, but again, you can't count those cases. So we don't mind you going on a mission trip during that time, but as far as doing a full semester in international experience, the answer would be we would not be able to approve that clinical site on an international location. It doesn't hurt to have a Sigma Theta Tau membership. It is not a requirement. It is not weighted, something we put weight on when we do our calculation. So it's not a requirement. Really, we go by the criteria. If you if you have the criteria for an early interview, you're granted an early interview. Now, how you do in that early interview determines kind of a scoring system and where we place you and look at the interviews for that week, and we then offer people a slot in the program. With that offer, though, does come a deposit that's all in the handbook as well for information, but we really just look at the criteria that's outlined in our handbook, and if that criteria is met, we offer an early interview. Everything is online when it comes to interview because of COVID, and so much like what we're doing here, some of us may be in the same room together, but you certainly will just be at home or somewhere quiet, and you will interview. We've had people interview in hotel rooms before that were on travel assignments. So you will be in whatever place you can find that you can have a quiet conversation. I'd encourage you to rewrite your personal statement and kind of update us on what you've learned in the last year, certainly, and give us a new perspective of why you want to do this. So I would say you probably would need to rewrite your personal statement. The advanced patho course is twice a year. It is offered in the winter semester currently and also in the fall. It is not offered in the summer. I don't think we track how many hours the students have that shadow, so I can't even give you a number on that because that varies, you know, applicant to applicant. I'm not sure what the next question is. I don't know if that's compare or what that is. Yes, you can certainly log those hours on your application, yes. The memberships do not necessarily help you, but certainly I would put those on your application. Advice as far as being in the nursing program, I would say again, make sure your grades stay good. That's the biggest thing to help you through that program. Go to an ICU and start logging those hours. In spending time in the ICU is learning as much as you possibly can. Always ask the question why. Why am I doing this? Why is this acting this way? Or why is this medication doing this? Or why is this patient situation this way? Always want to know down the deeper level of every medication that you're using, the purpose, the intent, the cellular components of why this medication works the way it does. I think it's the best advice I can give. I tell you, I was hoping that emotional intelligence would be the big hit as far as interviews. I still don't think that anyone knows exactly about how beneficial emotional intelligence doesn't help us necessarily pick a more qualified candidate from the research that I have looked at. Other programs are still trying to evaluate how useful that tool is. So I don't have experience with using it, but I've heard this mentioned at our meeting in February of all academic and clinical faculty. And I wish there was a perfect way of doing interviews and determining who's going to be successful on passing boards, but so far that's yet to be determined. Again, you do not have to have the Sigma Theta Tau, but it certainly is not frowned upon. The higher acuity ICU, you're going to have more experience in running more drips. And so those are things we are looking at. It's not a requirement, but certainly what is your knowledge base on those drips and so forth. So there are people that interview very well from lower acuity ICUs because they're prepared or they have taken the time to learn and dig deep into what they're doing in the ICU and the therapies that they're using. And so years of ICU experience, again, is based on a study that says if a 3-year ICU nurse does better in anesthesia school than someone who's been out less than that. 4 years, 5 years, where is the cutoff? Well, we don't really know specifically, but certainly 3 to 4 years seems to be a perfect level of ICU experience because now you've probably been given more responsibility for patients that you didn't in your first year. And you understand more and know how to communicate better with physicians and other coworkers and that kind of thing. So sometimes it's where you live. You may not have a high acuity ICU, and I'm not going to be the one to tell you to move to a city that has one specifically to try to get into school. I think that would be unfair to you. But certainly, again, what your knowledge base is on the ICU that you work in is very, very important. Not for, I may have already answered that. I'm not Seventh-day Adventist, so you do not have to be Seventh-day Adventist to come to this program. I was born Baptist, went to non-denominational type Baptist churches the majority of my lifetime, so no, you do not have to be a religious person to come to this program. You will be respected as anybody else would be, certainly. And we do not ask those questions when it comes down to your interview as well, Brittany. We do not ask what faith you are, whether you're a Christian or not a Christian. Those are things that we do not ask in the interview. We do not discriminate. Just like any other place, we don't discriminate for age, color, sex, religion, anything. That we would not at all hold that against you or ask you any of that kind of stuff. Could you commute from North Alabama? That would be tough because the time spent in the car is time lost for studying. I will say that. We do have people that live in Kentucky that do commute down. I've had one student there for a while at the very end of the program who lived in North Georgia and commuted every day, and that was crazy. But certainly you have to realize you're going to lose time in the car spent studying. There is call requirements, so you would have to stay and be within a driving distance. The call is not in-house, so you would have to have some type of housing here where you could live. So you would, that would be hard if you lived in North Alabama and did not have a place to live. You wouldn't want to stay in your car at night. But that would, most people do move to this area for the majority of the program. We will do a cumulative GPA, and then we will pull out your science courses ourselves and calculate a GPA. And so obviously your nursing experience, more recent experience, we'll look at that separate too, because again, you may not have done so well long ago, but at least it was a science degree. And then we will look at all your science courses and calculate a GPA that way. Yes, you are told early if you interview early. In fact, we usually do all the interviews for a week, and then we let people know whether they are offered a slot or not. And then we do more interviews the next week. Yes, you're notified at the end or the first part of the following week after you do an early interview. What if you don't get in on an early interview? Then what will happen is you will go back into the general interview process. And so we won't necessarily have you re-interview, but we will look at your scores and everything, and then we'll see how you compare with the general interviews, those who don't meet that criteria. We do not take a full cohort during early interviews, so that does not necessarily eliminate you from the chance of getting in the program. And so again, we're going to still interview people who don't have that level of criteria. Certainly as we go down below the level of criteria, 3.4 science, 3.4 overall, those kind of things, you know, we don't go much below 3.0. So certainly there are slots filled with early interviews, but we do not take a full cohort until after the general interview process. Does age play a factor? We have several people that are in their 50s. So you're 33, you're good. I was 33 when I went to school. You're probably a very mature person. You're good. Already answered that about nursing school. We don't necessarily preferential treat any ICU when it comes down to your interview. So you could have CV experience, you could have surgical. We're going to cater your interview to those type of patients. So There's not one specific unit. We do tend to have a higher expectation of those in a cardiac unit because we focus on the specific nature of those patients. But no, we don't specifically take X number of people from a cardiac unit. It can be, again, any ICU. Every time, yes, if you're reapplying, you certainly need the same type of reference letters as you had last year. They just need to be from obviously current people and from those outlined in the handbook and on NursingCast. All right, well, I see no more questions in the queue, so if no one else has a question, then we will draw this to a close. I appreciate your time and as well as your attention. Up one more, how much? Well, we have a rubric on the scoring system. So again, your science GPA, your other factors, cumulative GPA, all those go into the rubric. And so your interview gets a score, but we discuss your interview score amongst the group that you're being interviewed by. So we come to a agreement on what that score is. And so there's both clinical, obviously, personal questions don't weigh that much because again, we're just more trying to learn about you, but the clinical question certainly is a gradable thing within our rubric. Well, again, thank you for your time and attention. I appreciate your interest in Middle Tennessee School of Anesthesia. Please contact us if you have any further questions, and I hope you have a wonderful evening.